I'm Rebecca, co-owner of Le Petit Surrogacy.
I'm Zozula, CEO at Le Petit Surrogacy.
My name is Mitchel Schiewe. I'm the Laboratory Director for Reproductive Partners Medical Group and the Fertility Center of Orange County.
So what does an embryologist actually do?
Aside from never sleeping, most of the embryologist job starts early in the morning. Usually the first thing that's done in the morning is what we call quality control. Somebody comes in and checks all of the incubators.
You go right into checking fertilization and embryo assessments, which in a big program can take hours to get done, while some other people are working on retrievals, other people are working on thawing embryos for frozen embryo transfers.
And after that all happens, generally egg retrievals will start, and you do the egg retrievals in the morning, and usually several hours later you start doing the ICSI process. And the other thing that kind of goes on in the middle of the day is embryo biopsy.
At what point does an embryologist actually get involved?
The embryologist is involved from point zero. We need to make sure that, one, the equipment is functioning properly, that the patient's embryos are optimized. Embryologists are intimately involved in every aspect of the patient's treatment in the laboratory.
Everybody's situation is unique and different, but from the purposes of the day-to-day, this is the moment an egg retrieval happens. From there forward, the embryologist is directly involved in subcapacity.
How long are frozen embryos and gametes viable for?
The way we cryopreserve eggs and embryos today is a process called vitrification. Vitrification forms like a solid glass. So it's like a piece of Murano glass with your little fish sitting in there, but they're embryos, and they're sitting securely for weeks, months, years, decades. As long as they are maintained in storage in liquid nitrogen, which is a negative 196 degrees centigrade environment, very, very cold, their viability is indefinite. They will outlive us.
When people hear the term creating embryos in the lab, what does that actually mean?
An embryo is composed of the genetic material from a male contributor, sperm, and a female contributor, the oocyte. Creating embryos in a laboratory is a process called ICSI, which is intercytoplasmic sperm injection, which is where you actually pick up an individual sperm and go through the outer part of the egg and actually deposit the sperm in there so it can combine with the genetics from the egg. And then at that point in time, that's basically when you start calling it an embryo.
These days we use plastic dishes, and majority of the time these days we actually do single sperm injections into the egg. But there are quite a few patients that still have conventional IVF, which means taking 50,000 sperm and surrounding it around an egg and letting the good one penetrate.
What goes into selecting the best sperm for ICSI?
We've improved so many aspects of the lab. I think the next hurdle really to improve our pregnancy rates 2, 3, 4% even has to do with sperm selection. We have new ways of processing sperm through microfluidic type gradients. If you just patiently wait for sperm to mature, they actually do start moving. And if we can select the most motile, highly progressive sperm that are normal in morphology, then we're going to have our best outcomes.
Where do you see the growth evolving in the field of embryology, especially with the development of AI?
There's a lot of technology that's out there. Where we are today is very different than what was in the laboratory 10 years ago. Was when some of the stuff with time lapse was kind of essentially the original almost AI. They were using these time lapse machines, and they were recording all the data. Somebody in the back end would analyze it. They would build something into this model. And that was kind of some of the early AI models in embryology, wouldn't you say?
Not that I'm in full favor of that, because I don't really want to be replaced by a robot, but there are various aspects of AI that may give us better predictive abilities, but again, it's not going to be a perfect system. It probably won't improve the prediction of, say, genetic testing, but in combination of different AI components, we may make improvements there. If we could just come up with a robot to make dishes, the dish prep process, the labeling, and that would be really helpful from the labor side. The number of cases of IVF will continue rising, but the skilled labor of embryologists to keep up with that is not going to. So we really need embryologists to focus on the key procedures like ICSI and biopsies and all those things, so that machines can help with some of the setup and low-end things. I'll give you a couple examples. One area that we're looking at investing in AI right now is a program called Sperm Search. And that's going to be really helpful for testicular samples, because testicular processing of very difficult samples, like men who have very few sperm, you're looking in this forest of cells trying to find a needle in a haystack. It could take an embryologist days to look through all the material we're given. The program has basically said that the computer can find it in 0.2 seconds, whereas the embryologist may take 30 seconds. And plus, the computer's never going to get tired looking.
What's the most delicate part of your job?
Well, when I was an embryologist, every single step is a delicate part. So you have to do things in a expedient fashion. You want to do everything as quick and as efficiently as possible.
Really, the most critical part of our job is to make sure that embryologists are properly trained. Every step has a critical component to it as far as training. And the reason why it's important is so that they can do their job without thought of worrying about what they're doing. Because it's a very high stress position when you're dealing with creating a couple's embryos. You have an accident, you drop a dish, or you pipette an error, that's a very precious item. So to minimize the risks of what we do and to be able to train people in a fashion, or not worrying about that risk all the time, that they can confidently do their job. It's been assessed that there's probably about anywhere from 75 to 100 check and balance steps in every job we do, day 1 to day 7, or FET.
Tell us more about embryo biopsy and PGT and how that's resulted in changes in the field and transfer of embryos.
The genetic testing is we're basically taking some samples, a couple of cells out of the blastocyst, and blastocyst has 100 to 200 cells, so it's a very small amount, and those go off to a genetics laboratory where they're able to analyze them for proper chromosome numbers. It's gotten to the point now where it's so complex that they're essentially able to analyze the entire genome in the embryo. It's just a way to help ensure that you're giving the best embryo forward.
The real value of genetic testing in that situation, especially say an older woman that may have a lot of embryos, but if you were just to transfer embryos without testing, she could go through numerous spontaneous abortions and maybe lose a year of her fertility during that process. Whereas if we do genetic testing, we sort that out to begin with. We help eliminate the spontaneous loss so she can be successful sooner with a healthy baby. Vitrification was a game changer in cryopreservation, because embryos before that we weren't sure would survive now survive 99% of the time. The fact that we could confidently freeze embryos knowing they won't change 99% of the time, we have the flexibility to do frozen embryo transfers instead of fresh, which improves the synchronization of the uterus to the embryo. And that's really important for the surrogate, because then you have time to plan for the surrogate and make it happen.
Has there ever been any study that looked at music or type of music with
There-
embryology development?
There have been a few abstracts. Embryos like music. The vibration somehow, like the heavy bass or something.
Happy embryologist.
Happy
It would
embryologist
work better,
could
you
be.
know.
Certain music we like to play in the lab to make the embryos happy. I would always tell the patient the most important thing to do is to not stress out. And I think the same is true for embryologists. Anything we can do to reduce stress in our environment, anything we can do to reduce the stress in the patient, is all going to have a positive effect on the embryos and outcome.
Embryologists are really like your first babysitters, essentially, so I mean that's kind of what we are. We're just making sure that you get your eggs, embryos, whatever you give us back in the same way that you drop them off.